Not knowing like what their response was to it was the scariest part for us, because they would be good 1 minute and then they would be crashing the next.
Wendy Beyer is a registered nurse in the cath lab at Mercy Hospital of Buffalo. But for 10 weeks, she found herself in a world she did not know at Sisters of Charity Hospital, St. Joseph campus.
It was very trying in the beginning. To me, it reminded me of like war medicine, because we didn't know what to expect.
As you may recall, to make sure there were enough beds to treat COVID patients, St. Joe's was converted into a COVID-only hospital. Catholic Health shared these photos with us, giving us a glimpse of what it was like inside. Beyer says medical professionals from across the nation teamed up. That was challenge one.
We don't know each other's strengths and weaknesses.
But nothing compared to the uphill battle that came next. Beyer said COVID quickly proved itself to be unforgiving, relentless, and at times they felt helpless.
FaceTiming with families because they weren't allowed to come in, and we are, terminally weaning their loved one. That was probably the hardest thing for us to do, all of us nurses.
Beyer says at one time there were 4 critical care units, and to get inside them safely, there were 3 areas: green, yellow, and red.
Green was your safe zone, so when I would come in the morning, I'd usually get there about 6:15. We would change into hospital scrubs.
The yellow zone was where hand sanitizer, gloves, and a mask was put on.
And when you're in the red zone, which is the hot zone, you were putting, N95 and other masks. We had caps on, and then surgical caps, gowns, gloves, and then we would go into that area.
Then the grueling 12-hour days would begin. Beyer says they always had enough PPE, and miraculously, she never got sick. A feat president of Mercy Hospital, where Beyer typically works, is thankful for.
What was odd about it is that you really couldn't tell what day of the week it was. Saturday, Sunday, Monday, Tuesday, none of that really mattered, because every day we were doing the same thing.
Which was saving lives.
First week, when we started seeing patients, the census in our system jumped up over 30 patients. And then the week after that, we were up over 50. And then from there, it leveled off and slowly trickled down.
Eddie Bratko had been on the job for just 6 months when the pandemic hit.
A very interesting ride. I would say that I've had to do things that I never expected we would have had to do. We certainly kept the safety of our staff, our patients, and the public at the forefront of everything that we did.
And that continues as cleaning former COVID units has been underway for weeks to return them back to normal use. And with that, Beyer leaves you with one final message to keep it that way as COVID cases spike across the nation.
This disease is not forgiving for anybody, whether you're 20 or if you're 100. Wash your hands, wear a mask. That's all we're asking you to do, just so we don't get back to where we were back in March.